Hello, good afternoon. Thank you all for joining us. We just had an excellent panel on peer support workforce. And I have the privilege of introducing you to the Creating Recovery Friendly Workplaces panel. So my name is Vanessa Devereaux. I have she, her pronouns, and I'm the director for the Division of Community Engagement, also called DCE, at the Colorado Attorney General's Office. And one of the units, there are many, but one of the units that's housed within the Division of Community Engagement is the Opioid Response Unit. And I know the team with Jamie Feld's leadership has worked really hard to put together this conference, and so just wanted to take a moment to acknowledge them and all their work. And transitioning into this panel and how critical and important recovery-friendly workplaces is, it's programming that aims to enhance workplace well-being and safety and leadership skills in supporting employees affected by substance abuse. And I think the whole point is to try to enhance or transform the workplace culture into a stigma-free and inclusive environment. And so with an emphasis on the importance of establishing a healthy work environment, and including the offer of an opportunity for employees to maintain their recovery and their wellness. That's really what we're here to discuss today. Talking more about the Colorado Attorney General's Office, we have taken a pledge to Colorado's Recovery Friendly Workplaces Initiative. And basically, you're joining a community of advocates committed to this work and these principles. And so I would say if you haven't taken that pledge already, I would encourage you and or your organization to look that up and pledge your support as well. Another thing for the Colorado Attorney General's Office is that we had as a priority area within our impact grant what was announced earlier at the plenary session, promoting recovery-friendly workplaces as one of our 6 areas of focus. And one of the impact grantees was John and his organization, which is Recovery Friendly Leader, RFL. And we awarded him and his organization $125,000. And so without further ado, I would like to turn it over and introduce our panelists for today. Dr. John Narine, founder and executive director of RFL, and David Shapiro, who is the assistant director of programs and partnerships, Center for Health, Work, and Environment at the Colorado School of Public Health. Please give it up for them.
Thank you so much. Thank you, Vanessa. Thank you for the introduction. David Shapiro, I use he, him pronouns. I work at the Center for Health, Work, and Environment, which is located at the Colorado School of Public Health. And my hope for today is to talk to you a little bit about the workplace end of supporting individuals. I really loved that last panel on peer recovery workers because the workforce is so critical in doing this work. And yet we know that making sure people work at workplaces that support their journey as part of their recovery capital is so important and critical as well. And that's what we aim to do with the Recovery Friendly Workplace Initiative. So our center, the Center for Health, Work, and Environment, we're one of 10 centers of excellence for total worker health. So our primary funding comes from NIOSH, the National Institute of Occupational Safety and Health at the CDC. And we've been working intentionally for the past 15 years or so on worker health, safety, and well-being. And the way that we got to some of the recovery-friendly workplace work, it makes sense in my mind, but maybe I can sort of lay out the steps for you. In fall of 2021, we were funded to translate public health guidance around COVID to the small and mid-sized business community in Colorado. And then we quickly realized in those conversations that mental health, isolation, and the recurrence of symptoms and substance use disorder was occurring for a lot of employees in the businesses that we talked to. And so while we had always focused on the mental health and well-being of workers, We didn't have such a strategic focus about it until May or so of 2021. And then we kept having more and more conversations. And then out of that, we ended up with some American Rescue Plan Act dollars to launch Colorado's Recovery Friendly Workplace Initiative. And that's what I want to speak to you a little bit about today. We have a definition that's up on the screen. There's two definitions that are up there. On the right-hand side of the screen is the National Institute for Recovery Friendly Workplaces definition, which was created by some lawyers, and it's a little bit longer than ours, but the main focus of their definition is policies, programs, and practices, right? And so what policies does your organization have that supports individuals in recovery? What sort of practices how do you walk the talk with individuals who are in recovery? And then what sort of programs do you have? Now, the Colorado definition I'm gonna read to you, an organization that uses evidence-based policies and practices to unite the entire organization by recognizing recovery from addiction as a strength and by being willing to work intentionally with people in recovery. There's a few elements of that definition that I really like to call out. The first is evidence-based policies and programs. You've probably been doing a fair amount of talking about that already at the conference today, making sure that whatever we're doing when we're supporting individuals in recovery from substance use is grounded in science. And that's really important in the business community when the wellness atmosphere around business is so large and so vast and not always grounded in science. The second piece I like to call out is unity and uniting the organization around a strength of individuals, right? Diversity, equity, and inclusion is an important conversation in the workplace, and the more we can honor individuals' life experiences as part of that effort towards diversity, the better. So uniting the organization and then recognizing people's history and people's lived experience as a strength for the organization. Those are the three pieces of the definition I like to sort of note. Colorado is one of over 35 states that has a recovery-friendly workplace initiative. You can see the purple map here up on the screen. Some of these states that are in purple have an initiative in one specific town or city. We are for the entire state, and so our goal is to launch and roll out regardless of where a workplace is located. We will have an advisor, and we will have a coaching program to support business leaders. And in the last bullet point there, we are the first nation, or we are the first state in the nation to actually pass legislation that funds a recovery-friendly workplace certification program. So I'm going to talk in a moment about Senate Bill 48 that passed this past spring, the Recovery from Substance Use Disorders bill, and 11 out of the 14 pages in that bill were dedicated towards the Recovery-Friendly Workplace Certification Program. So we're pretty excited about that. We have a work group that's supported by the Colorado Consortium for Prescription Drug Abuse Prevention that acts as our advisory council for the work. I'm a co-chair of that work group, and so once again, we are grounded in a lot of the partnerships and the work that you all are already part of and are doing. So Senate Bill 48 passed this past spring, and I've been asked to present Senate Bill 48 in a number of states around the country, including, lo and behold, at the White House 2 weeks ago, which was really an interesting invitation that came pretty last minute. But people want to know, A, how did we get it passed, and B, what was unique about it? So the first thing that's unique about Senate Bill 48 is it approaches recovery from a variety of different ecosystems. There are 4 components to the bill, and I really love this about the bill. There are supporting recovery-friendly workplaces, the program that our center is going to administer. There is a grant program for recovery high schools. There is also a cleanup in technical language around recovery residences. So sober living homes become recovery residences, and that changes zoning requirements and how many people can live in homes. And then finally, the most contentious part of the bill, if any of you were tracking it, was how beer and wine are sold at grocery stores. And so all 4 of these domains were part of Senate Bill 48. It's really looking at the infrastructure in our state to support individuals in recovery at work, where they live, where they shop, where we shop, and also this high school-based program as well. So that's one thing that's really unique about Senate Bill 48, and I think why we were successful. There are 2 elements to the program that is worthwhile for you to know about. And as Vanessa said, we'll have a slide here in a moment, and I have some flyers up on the tables here about taking the pledge. So the first step is becoming a participant in the program. And it's really simple. You sign a pledge, a letter of commitment that you're willing to have a conversation with people who are in recovery, that you're willing to work a little bit more intentionally to find out what's going on at your organization and be better. And then in doing so, you'll receive your name on a website and you'll be assigned a recovery-friendly workplace advisor. So we're hiring for that position right now. So that's participation. Certification is where the rubber meets the road, and it is a little bit more stringent. Certification, which will have a badge that goes along with it that businesses will be able to place on their website. It'll be digital and in print on a window, on a door. But certification will have a brief organizational assessment that the company will take. Questions like what sort of mental health benefits do you have for your employees, and are those mental health benefits meeting their needs? What sort of education and training do you have available to team members, including to supervisors and managers? And we're going to hear a little bit more about training in just a moment. Our goal is to launch the certification program no later than the first of the new year. And so we have 4 years of funding through Senate Bill 48, and our goal is to have a few hundred businesses throughout the state participating and getting certified as recovery-friendly workplaces. As Vanessa mentioned, we already have a lot of businesses interested in this work. So we have almost 80 companies that have taken the pledge already. This is without any marketing or effort going into it, just people who have heard about the initiative through presentations like this. There's a few that are highlighted here on the list that I want to draw your attention to. One is the Center for Health, Work, and Environment, where I work. So we are committed to being a recovery-friendly workplace in addition to advising other companies on how to do that. I also highlighted the Colorado Department of Law, Attorney General Phil Weiser's office, who recently signed the pledge. The Colorado School of Public Health is where we're located. And then John's organization, Recovery Friendly Leader, is on the list as well. So in thinking about how you're going to engage with the business community in your domain, whether that be through your board of directors, through your local community, the first step is looking under the hood and looking at your own organization and making sure that you're supporting the individuals with this lived experience before you're recruiting other businesses to do so. And that's the biggest point I want to make about this initiative and why we're so grateful to be here today as part of the invitation to participate in this conference and to have the Department of Law as one of the newest members on the list who have signed that pledge. So if you don't see your organization's name on this list, please make sure to take a flyer, to take my business card and come up to me afterwards. This is going to be the first group of businesses that has the resources to go through certification, right? It's going to be difficult, or we won't know who you are unless you sign the pledge and give us some information about getting certified. And my last slide, what is a recovery-friendly workplace? So we had a brief definition to start out, but there are 6 main components here that are up on the screen. The first one is the organization is knowledgeable, right? That's that evidence-based scientific approach to supporting individuals in recovery. And we're using a pretty broad definition of recovery here. This is recovery from mental health conditions and substance use disorders. And so anywhere we're talking about someone in recovery, we're talking about a broad spectrum of behavioral health support. Aware of stigma, if I was to put up some data here about why people don't get help and support, and perhaps you all know this, it's really because of stigma. And in the workplace, and John again is going to speak about some stigma in the workplace, is a place where even though we've made some gains on talking about mental health in the workplace, we're still far away from normalizing the conversation around alcohol use disorder or just alcohol consumption in general and substance use disorder. Being equitable, so this is part of a DEI initiative in a lot of organizations. Being supportive, that human-centered approach, so meeting individual workers where they're at, understanding that for us in the program, no two businesses are the same, even if they're in the same industry or above the same size. Just like when working with individuals in recovery, no two people are the same. Being compassionate, I think those last two, supportive and compassionate, kind of go hand in hand. And then being certified, participating in our initiative to become certified through the state-run program. And as I said, all of the infrastructure, the website, the training, and the certification components will be coming soon in the next 6 weeks to 3 months. So here is a QR code for the pledge. It is also on the flyers that I have up on the screen. That's the first step in the process, is to read the pledge and to take the pledge. That's how you get into the network and how you get more resources about how to do this. So I'll leave this up for just a moment. If your business or organization wasn't on that list or you didn't see them, I know the font was kind of small, so you might not have been able to see anything. Yeah, and it's on the flyers. It's on the back side of the flyer too. And my contact information is there as well. Thanks for the opportunity to speak today. I'm happy to talk a little bit more about the workplace and how supporting worker health, safety, and well-being, this is a critical component of how we do that work in Colorado. With that, I want to turn it over to my friend and colleague, Dr. John Narine.
Good afternoon, everyone. Man, I'm really happy to be here. You know, my name is John. I'm a person in recovery. I'm the executive director for Recovery Friendly Leader, and as a person in recovery, I did struggle with addiction for many years. When I was asked to come here today, I was asked to really explain why I decided to do this work, and I can't really do that without telling you what it was like being an employee. So, the funny thing about being a recipient of this grant, which we are so grateful for, I mean, the last 2 years was a struggle just to, prove that this thing actually works and finding someone who believes in us. And we really thank you for believing in us and giving us the money to help us help others now, people who are just like me. The funny thing about this grant too is I worked in law firms for about 10 years. And in that experience, happy hours were the thing to do with attorneys and paralegals and judges, especially if you were a paralegal. In the types of law firms I worked in, if you can go hang out with the judge and get our firm in good eyes, we'll give you a raise. That's just the type of culture it was. So for many of us to drink to the point where maybe we didn't show up to work on a Friday or Monday or called in late or took more smoke breaks, whatever it was, and didn't get work done, that was pretty much normal in my work experience. I remember that there was some type of change that happened with me, though, amongst this group. All of a sudden, I was the one really not showing up on Tuesday or Wednesday. I thought everyone else would do that too, but no, it was me. I was the one who wasn't turning in anything when I said I was going to. So it became much more noticeable that my drinking was affecting the workplace much more than others. The type of culture that we had, right? I remember going out to happy hour and attorneys, right? Managing attorneys wanted to get cocaine for us to use together and maybe get some weed or some amphetamines, whatever it was. And I joined in on that, but they showed up for work. I didn't, but I thought that was okay to do just because of what I saw in the workplace. Later on, when I moved to Colorado, I found a program that was working for me at the time. I had about 10 months of sobriety. I got my own apartment, and I remember one day after a work happy hour, I was good. I didn't drink at all. But on the way home, I stopped by a liquor store and drank by myself at home, then invited somebody over who had drugs because I wanted drugs instead, and didn't show up Monday, and I called off sick. And I was so upset that I did that because I really thought that this program I had was working. I was showing up to work. I was finally turning in things on time. I was honest. And here I go again, doing the same thing. And what am I supposed to say? Right? What am I supposed to say? I went into work Tuesday. I sat at my desk. I got in early, and I was like, I'm going to tell my boss what happened. I'm going to go into her office, and I'm going to confess and let her know that I really wasn't sick. So I gathered all the courage I could, and I went in there. And when she came in, I shut the door, and I looked in her eyes. And all I can think about is, how am I supposed to tell you this and keep my job? I had no idea, right? So what came out of my mouth was the next best thing I thought I could say, which is, I'm an alcoholic, and that's why I relapsed. Because alcohol was what we did, right, together, at least at this firm. The bottles of liquor I see in all the attorneys' offices given by clients on display, right, is okay. I may have a chance if I say the legal thing versus anything else. I had to live with that lie and try to get sober with that lie now at work, and it just ate me up. So the reason I do this work is because that's the employee I'm looking to help. The one who's sitting in silence, suffering, not knowing, how do I ask for help and be worthy of it? How do I say there's a problem? Maybe not need to expose what the drug is or whatever it is. I personally have never used any drugs at work. The attorneys that we were doing this with back 10 years ago, none of us ever did it at work, right? But how I affected the workplace, right, was much differently. So if I were to ask for help, would I be seen as different, even though we were all doing the same thing, just because it affects me a different way? That's the struggle. So that's what we do here at Recovery Friendly Leader, is we train managers how to actually show the support to all the components that David mentioned that a recovery friendly workplace offers. The place I worked at, where I admitted I was an alcoholic, was technically a recovery friendly workplace. They had the culture, they had the policies that protected and supported, they had the resources, flex time. They called them mental health days if we ever want to take one, never have to give a reason. They had everything, but no one had any training. So when I came forward and asked for help, no one knew what to do at all. They didn't know what to do with any of this stuff. They were flying blind, and I was the test for them. So, thank you. So, just to go over again, Recovery Friendly Leader, we train managers on how to support employees in recovery or struggling with substance use. What do you guys think a recovery friendly leader is? I want to ask you. Yes. A listener, someone that can understand someone's need. Brilliant. Anyone else? Yes. Create safe spaces for employees. Yes. Yes. For the sake of time, thank you. Recovery Friendly Leader, first of all, is someone who is a good listener, who creates those spaces. It's someone who can influence and demonstrate those behaviors we're expecting from employees, right? Someone who can have those conversations and address substance use appropriately in the workplace. A Recovery Friendly Leader works somewhere that's going to support them when they're supporting employees, like the Recovery Friendly Workplace. Because the last thing we want to do is help you understand how to help someone ask for help, how to help them feel comfortable asking for help if you work somewhere that's zero tolerance. What did we just do, right? So we got to make sure that we're working somewhere that's going to support our efforts. And finally, someone who's going to practice what they learned, because that's really the only way this is going to work, right? We sit in hours of Zoom training or in-person workshops. When we go back, let's put these things into action. That's what a recovery-friendly leader is. The training that we offer is really broken up into two segments. One is how to address substance use in the workplace, and through that we assess how to recognize those signs before someone's in the bathroom for too long, which is what we're hearing. That's how people understand when there's a problem. Well, what was going on before that? That's what we can help you understand. And then how to have those conversations, right? How to address the behaviors or the performance issue without needing to accuse if it's not obvious. We'll train on how to do that. The second part really goes into how to demonstrate what an inclusive work culture looks like, right? We have these policies in this culture. Well, what does that look like when I have these one-on-one conversations with employees, right? How do I encourage them to speak vulnerably and appropriately about things in the workplace so they can stay in recovery? Because what I learned on how to stay in recovery is I need to share about stuff. Because if you expect me to stay sober and keep it a secret, tell me how to do that. I have not learned how to do that. So that's what we train on. Thank you. We have 5 minutes left, and we are open to any questions that you like. If you want to hear more about our organization, I do have flyers there on the table, or you can contact me with my email up there as well.
Thank you both so much. So my experience with my son is that when he's in recovery and he also is sitting with a felony, He normally gets jobs at restaurants or other areas where I didn't see any of those types of businesses necessarily on your participation list. A healthy, safe working environment for somebody in recovery with a felony is very difficult to find. Now, how would we get those types of businesses on board with this? Because the back of a kitchen, that's a hard place to stay sober.
Thank you for your question. I worked in a restaurant as well, front of the house and back of the house, and you are correct, right? When we are being offered cocaine to do a 12-hour shift, it is, or have to taste the drink specials, it is difficult. What I can say is that there are some restaurants, some that Dave and I have talked to, that are curious about how they can help. There's policies we've heard of about how to take shots together as a team that they are, that was news to me, but they are interested. So slowly but surely, I'd say some restaurants are coming around. There's one I know of personally in Denver that is a recovery-friendly workplace. People in recovery are part of the executive team of that, and they are willing to adjust shift schedules so that if you're a person in recovery, we won't put you at the closing end so you don't have to be alone with the liquor. Right? We'll put you in the day shift with other people. They're doing some things like that. But I do think that it's still something that we need to talk to more restaurants about. David?
The only thing I'll say is there are some restaurants already on the list. It's an industry that we know is of high need, just like construction is. And our hope, after a few years of doing this, is that we could pair someone like your son with a business that has been certified as recovery-friendly workplace and is ready to support someone like him. It's not going to be all of the businesses. It's not going to be all of the restaurants. But there are certain main streets around the country, like Steamboat Springs is a great example of a main street where we have a number of restaurants and even bars and coffee shops that have gone through recovery-friendly workplace certification. And it is going to be one main street at a time, is my guess. And it's happening more right now. The conversation's happening a little bit more in mountain communities than it is in metro because of how affected they are by alcohol use disorder. So it's coming. We recognize that there are high needs industries like restaurant and hospitality and construction, and it's our goal that the next time those back of the house conversations are happening, that people are working in a recovery-friendly workplace.
Hi, we actually took your pledge. Our name is on one of those lists, but I am curious too if the organization is aware of that it's a recovery-friendly organization. Are there guidelines on whether or not there's disclosure for a need, or do you follow any guidelines for just continuing to be supportive even if they're not in a place to disclose that maybe there was a reoccurrence or a relapse?
Well, I mean, the first thing I just want to mention, I'm not sure I fully understood the question, but this is an organizational initiative, right? So, one of the things that working at the Colorado School of Public Health and the University of Colorado is this right now is not a study of individuals in recovery necessarily. We may get there with additional funding down the road, but right now our goal is to support the human resource managers, the small business owners in shops like where John worked, so that when someone does disclose, they feel more comfortable supporting that individual, right? And so it is a workplace-based initiative, not a workforce-based initiative. My hope, and I think what I was hearing you say, is how do we know if a workplace has individuals who need support? Is that kind of what you were asking?
Is there any sort of pathway that you would take for somebody that wasn't comfortable disclosing that they needed that assistance until there was a problem?
I see. Great. Well, the training and all of the elements that we're talking about are people who are affected by substance use disorder. So it includes family members, it includes colleagues and coworkers. So the first thing is it's a broad training. So it's for as many people as possible. But the other thing I do like to mention in this conversation is it is a bit of a two-way street, right? My work is primarily with workplaces and human resource professionals, and they don't know what they don't know. And so if someone is not willing to come forward and talk about it, and there could be a lot of reasons why, plenty of barriers, stigma, loss of job, the reality of it, maybe just fear. that can be a really challenging conversation. There's only so much that the business and the HR manager can do. But our hope is that the more the company puts out in writing and in communication, that they're supportive of these conversations. And we have seen this in construction companies where all of a sudden more and more people start to disclose, right? The first one goes okay, and that person comes back at an all-staff meeting and says, gosh, I was able to go through inpatient treatment and come back to this waterproofing company, and I'm still here on the job, and I'm willing to tell my story. And that small waterproofing company now has 5 or 6 people that have done that. And so just like breaking this barriers and the stigma goes with all of the work that we're doing, the workplace is another element of that. So it is a two-way street. I completely agree with that. We're trying to make the training elements as broad as possible so that if you're an affected friend or family member, there'll be elements of that training that work and resonate with you. And then also, it is going to require people being willing to step forward and having a conversation. And we know how hard that is.
Thanks for this. It's really important, and I appreciate it. I come from a really small town, really remote area in the southeast part of the state, and we have a lot of small businesses. That's, we don't have a lot of industry. We don't have big businesses, and we've had some small folks who have come forward and said, I would like to be a recovery friendly. I don't know how, and so I really I appreciate the training opportunity. As you were speaking, I was kind of going through the certification that our child care centers, we're also a child care desert, and so what our child care centers, and many of them were saying, I would love to be a 3-star, a 4-star, a 5-star. I don't have those resources. I don't have the right staff. I can't, with the education. So I'm just curious, for those types of really small mom and pop businesses, what resources does a business need to have, and what expectations would they have in order to, once I sign this pledge, now here are my resources that I need to put in, whether that's financial or personnel or whatever. So could you speak just a little bit about that?
Yeah, thanks for the question. It's interesting you bring up childcare. So before I was at the Colorado School of Public Health, I was working in early childhood and working on childcare certification and licensing requirements as well. And so I'm really familiar with that specific industry. The main answer is we want to meet companies where they're at, no matter what level they're at, and no matter what type of company they are. There are some common elements that organizations will go through, especially for the very small micro-sized businesses. One is a policy review. We've done a lot of employee handbook reviews and looking at drug-free workplace policies. And so what will happen is a small business owner, maybe they have a handbook, maybe they don't. They'll share with us some of the policies they're thinking about, and we'll suggest some language that's supportive of individuals in recovery that aligns with our training. So policy review is one piece of it. The other resource we want to make sure we're connecting employers to are the recovery treatment facilities and the recovery treatment options that are available to individuals either in your specific community or virtually through state systems that are available. So the connection to resources is not necessarily through the Recovery Friendly Workplace program as much as it is making sure they understand things like ownpath.co, other places where people can find telehealth resources if it's in a small community, and what treatment centers have options to them. So policy review, and then looking at things like, what type of medical plan benefits you may or may not be able to provide and what sort of resources are available. We are thinking that down the road we'll have a small grant program available to businesses as well. That's not in writing yet, so don't quote me on that. But my hope is our whole program is set up to support small and mid-sized businesses. We know that the large companies already have a lot of resources ready to go, so we want to make sure we shepherd and steward those small and mid-sized businesses. So I know we're at time. The 30 minutes goes by so quickly in a conversation like this. Both John and I are here, and I know that you have a break coming up next, so please feel free to come up and talk to us about any other questions. And thanks for showing up at today's session. We appreciate it.
Thank you all.